Hi everyone, it's Dr. Nonnie. So, I'm a GP and I'm also a GP tutor. But what many of you may not realize was that in 2019, my medical students gave such wonderful feedback. I was given an excellent GP tutor. And what I ask, do you teach? Well, actually, it's mental health that I was teaching them at the time. Well, I still do teach them mental health. And so I'm going to put my teaching skills to good use to educate Piers Morgan et al. On suicide. Now, suicide is the act of ending one's life. We all know that we all want to live. There's a song by that 12-year-old boy saying, I just want to live. So we all want to live. That is normal. We all want to survive. And it is unnatural to want to end your life. But the Office for National Statistics, if you look at the figures on their website, from January to September 2020, which also included deaths by suicide from 2019, was 3,441. The quarter three, which is from July to September 2020, they had 1,334 deaths by suicide. It was mostly male, so there was 992 men and 342 women. These are people that did not die from COVID, they didn't die from cancer, they didn't have heart failure. They died because they were fed up of living. They were fed up of life. And so before people get to that stage where they get to the point that they just want to end it all, they normally are depressed for quite some time. And you can see signs of depression, like not wanting to eat, not wanting to do what they normally do, not sleeping well, for example, people being teary. And so if someone says to you, I don't feel good, I'm depressed, I just want to end my life, you can't minimize that, because you could be the person that could help that other person. So don't mental health is not an obvious it's not always an obvious medical problem, because it is of the mind. That's why it's called mental health. So God forbid I were to have bruises over my face, you would know that there was something wrong. If I had my arm in a cast, then you could see there's an obvious fracture. Or if I had any other injuries that were, you could see that. Or if I had a limp when I was walking. But with mental health, it's inside. And unless the person has gotten to the point where they've become unkempt in their appearance, sometimes people come across and they're quite articulate and they look quite pretty and they get on with life, but inside they are suffering. And so that brings me on to how to manage it, because I don't want the video to be long. The first thing is to speak out. If you're feeling that way, or if you know someone who's feeling that way, get them to talk. Because like I said, mental health is of the mind. And how you heal the problems of the mind, yes, we can use medication, but we also use talking therapies, speaking it out, saying what's going on in your mind. That's quite important. If you feel too overwhelmed to speak, then click. If you go to the Mind website, or if you go to the Samaritans website, you can just click. You can email joe@samaritans.org.uk. You can just click on their website and get help. At least let's start that process. I know it's not easy. And the fact that it's not easy is the more reason why when someone tells you that they're suicidal, whether they're a princess in the palace or a pauper on the streets, don't say that they're not, because it's the person who's wearing the shoe that knows the point at which it hurts them. So give them that validation, because you could even lose your job, as Mr. Morgan has found out, or more devastatingly, you could lose that life. Now, I'm going to leave you with three things. If you're feeling suicidal, as I said, speak or click, pray, because God will send you help, I promise you. Then come and see the GP. As GPs, we are trained to spot depression, and obviously part of our risk for depression is this patient suicidal? We always check, and I always tell the medical students it's a must. You must always check that. So we're trained to do this, so I will not belabor the points. You can either phone the GP or send us an e-consult, and we will address you as soon as possible. If things are too bad and too immediate, call the Samaritans. I'll leave the number in the text. And also, there's a social prescriber who can help with things like debt management or domestic violence, or other things that you might need help with that cause you to be depressed in the first place. So through the GP, you can get these links of these people that can help you, and obviously we can refer you for counseling as well. And I hope that this has helped to validate the fact that people who are saying they're suicidal should be taken seriously, because this is my bread and butter. I've had so many patients and I haven't lost anyone. Thank God. They've all recovered and they've done well. And some are still recovering. But it's a journey. But the first step is asking for help. And if they come to you to ask for help, please help or signpost them. But please never, never, never say that it's not true. And if you like what I'm doing, I would appreciate it if you can click on the like and subscribe button, and also share this video with your contacts. Till next time, bye bye.